afternoon and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice. And I'm here today along with I'll let him introduce himself.
I'm your
best
friend and business partner.
Business partner.
I'm Dr. Robert Jaffe.
And you're Dr. Robert Jaffe.
I'm Dr. Robert Jaffe today, and I am.
You're not in any other days?
Today I am. And I am here to help you celebrate our program. Today we talk about sexuality, relationships, and those are big topics.
Every time.
Every time. And so I am also a licensed marriage and family therapist. I'm a certified hypnotherapist as well. And we are here with the goal of helping you, our listeners, become aware of your loving, authentic, true selves. We always dedicate our program to you. And without you, we wouldn't have a program. And we want to let you know that you actually do contain within yourself everything you need to feel happy, joyous, and free. We are born into our world as our loving, authentic, true selves, and that means that we come in open, we come in curious, we come in honest, we all come in as sexual beings, and we all come in trusting that the world's going to say hi in a friendly way. We have many other qualities, a couple of which are we feel calm, we can be emotionally open and connected to others, and we also have the ability to be confident as well as compassionate. And probably the compassionate part is the part that we all need to stay aware of and utilize in our everyday interactions, and especially with those people who are closest to us.
Exactly. Thank you so much for that introduction, Dr. Jaffe. And we would like to invite you to please call us, share your questions, your comments. Our phone number live here is 951-922-3532. You can also visit us at our YouTube at heart-2-heart.online/YouTube. And we have a special announcement to make.
We do. Today, and we're going to maybe do this for a while, we're offering a free 15-minute consultation with either Dr. Rashidian or myself, Dr. Jaffe. We won't do this on the air. We will do this online. And so the first person to call us with either a comment or a question, we will then take your information offline, and we will set up a time. We will have our 15-minute consultation, and you can discuss anything that's on your mind. And we will do our best to give you some clarity and some direction and some help in whatever area you need it.
There you go. So that's our offer, and we're here for you in any possible way that we can. And so with that in mind, Dr. Jaffe.
Yes.
So for today, I was thinking about, what's important to discuss during this pandemic? And I was going back and forth with variety of topics.
Mm-hmm.
And then one of my clients, right, she has an 10-year-old female and a 12-year-old male, child.
Right.
And then they both are going to have their education, their schooling online.
Mm-hmm.
And with that, there are some limitations, apparently, right? And one of them is health classes, right? So according to this mom, she had a discussion with her friends, right? And then other moms who share the same school, for their kids, they're going the same school.
Right.
And they had this concern because they always relied on a school to, what is that? I don't know why that phone is ringing, but somebody's phone is ringing.
Yeah.
So they had this concern that they relied on a school, right? They relied on a school for, we apologize for that, for health education, for variety of information that as mom, either they didn't know how to do that, or they didn't know where to get information from, right? Or they didn't feel comfortable to discussing, right? And one of them is about sexual concern, right?
Yes.
So the question that she asked me is, how do I talk with my elementary school age child about sex and sexuality?
Yes.
Right. And then the other question says, even worse, what should I teach my middle schooler about sex and sexuality? You know? And I said, you know what? That's a good topic, right? To talk about, because I'm sure that these questions are the two top questions that parents now ask themselves. If they have these age children at home, right? These kids are going online. They have, their chat lines with their friends and everything. We know that, middle school child, they are at the puberty age, right?
Right.
And this is the age that boys in particular starts with masturbation. They get, introduced to that. They feel it. So many changes, developmental changes, which is part of nature, comes to the play.
Correct.
Right?
Correct.
And they have, they deserve to have their information from the right sources, to become educated, to understand their bodily changes, to understand their feelings and sensations, right? And usually children also feel kind of embarrassed to go to their parents to ask these questions.
Right. And the parents also feel embarrassed to answer those questions.
Right?
Yes.
The birds and the bees, some bird, just drop you in our backyard and stuff like that, right?
Yeah.
But
whenever you say the birds and the bees, I remember my dad's discussion with me. I think I've shared that with you, but I'll share it with the audience. When I was about 12, my dad sat me down, and he said, I want to talk to you about something. And I said, okay. I sat down, and he opens this book, and he starts reading to me, and he's reading to me about fish. And he's reading to me about, the female fish lay the eggs, and the male fish come and they fertilize it. And he's reading, and eventually I fell asleep. And I woke up, and he was gone, and that was it. So then later on, as an adult, I said to him, Dad, you never had that talk with me about the birds and the bees. And he said, well, I tried. And I said, what do you mean? And he said, well, don't you remember when you were around 12 and I sat you down? And I said, yeah, you were talking about fish. And he said, yeah, well, I was working up to it. But he says, but then you fell asleep, and I figured you weren't ready, and then I never had the talk with you. So that was my big talk about the birds and the bees.
Well, my experience, I never had a talk about the birds and the bees. So I had, as a female, I had to really struggle to find my information, and then there were lots of shame and guilt and fear associated with that, right? Because I didn't know, number one, who I could trust to ask, right? I didn't have a health class during my school time, right? And then so there was this kind of a big chaotic situation about what's going on with me? Why am I having this period? Why am I, my body is changing and all of that? And only when I became much older, that's when I started to make sense. And so eventually it happened, but it was a really struggling time.
Yeah.
So our children here are very much fortunate that there are so many educational programs available to them, for them to go through, to learn about themselves, to learn about their biology of their body, about the changes of their body. And these are really essential points in growing up. And when parents, talk about, oh, I don't know what to tell to my daughter, or I don't know what to say to my son. And one of the primary concern that they have is, if we tell them what's going on, then they're going to go for it and they're going to do it. Well, I have a bad news for those parents. The time between parents refuse to tell their children about their sexuality and the time that children become active sexually is 6 months.
Mm-hmm.
That's per research, right? So the better, the sooner, children know what's going on, actually the safer they're going to be about their sexuality.
Right.
The more education they have early on, of course, age appropriate,
mm-hmm.
right?
Mm-hmm.
That's why, what do I say to my elementary school age? What do I say to my middle school?
Right.
So these are two different categories.
Yes, and require two different approaches.
Exactly.
And giving two different sets of information.
Right.
Yes.
Right. So some of the questions that, comes to the play is, what should I teach my elementary school age child about their body, right? About identity, about healthy social skills and relationships, about personal safety, right? About pregnancy and reproduction,
mm-hmm.
about sex and sexuality.
Mm-hmm.
Believe it or not, elementary school age child is able to understand us.
Yeah. Yeah.
Right.
Yeah. And like anything, you don't really understand until you experience.
Right.
Right. But they can certainly gain a lot of information. And then when they do start to have the experience, they will then be able to refer back to the information you've taught them.
Right.
And say, oh, this is what my teacher or my mother or my father or the person that was helping me understand this. That's what they were talking about. Now I understand.
Exactly.
Yeah.
Yes. And for the middle school child, so again, it's about their body, it's about their identity, it's about pregnancy and reproduction. It is about relationship, it is about personal safety, and also it's about sex and sexuality.
Mm-hmm.
So the topics are similar. However, the type of information we give them for our elementary child is at the level that an elementary child can conceptualize it. And for the middle school, the same thing.
Yes.
Right?
Yeah.
Now, middle schoolers have more exposure to information by the time they go to middle school.
Mm-hmm.
So they, for example, I have talked to children, and they tell me, they know about pubic hair, they know about period, they know about how the child is happened, but they are confused about how to put all of that together.
Yes.
Right. The girls at that age, they are confused about, what do you mean about ovulation? What do you mean about uterus? What do you mean about, because they can't see it. Mm-hmm. So it's hard for them to visualize it.
Exactly.
Right.
Exactly.
Yeah.
So we're going to talk more about that. And then also we're reminding everyone that you can have a free consultation with either the Dr. Rashidian or myself. 15 minutes, first caller. Call 951-922-3532, and we'll talk to you after our break. Recovery seminar every Friday from 9 to 10 a.m. See you there.
Welcome back from commercial break. This is Heart-to-Heart. Dr. Robert and Dr. Mitra here at KMET 1490 AM, ABC News Radio. Our discussion for today is about children and sexuality during pandemic, because they're not going to school and they may not have access to their health classes.
Absolutely.
Right. And I see some parents are kind of, are very much mindful about that and very much concerned about it, and
mm-hmm.
very much afraid of, because they don't know what to say or how to answer the questions, right?
Yes.
And this is something valid, something it's a new experience for many parents as they relied on the school to take care of these questions for them,
mm-hmm.
right? So they never thought that they're going to be in a position, I'm not that teacher, okay,
mm-hmm.
which is a difficult situation. So please call us at 951-922-3532.
And we're offering a free 15-minute consultation with either Dr. Rashidian or myself, Dr. Jaffe. Call 951-922-3532. We will take your information offline, and then we will set up a time, and then you can discuss any question or anything on your mind.
Exactly. So you have an elementary, you have a middle school, and so what do? So they come to you and they ask about their body, they ask about they have children actually these days, they may have these sophisticated questions, and then parents kind of become, oh my God, where did my child learn this from? I didn't say something like that. But I want you to realize that children, sometimes they ask because they heard it somewhere and they're just repeating that. And they can't make the meaning out of it either. So it's up to us to clarify where the child learned the information, what kind of a meaning they give to it, and actually thank them for bringing the question to us. Right.
And I'm glad you said that, because oftentimes parents are so surprised and taken aback that their child has learned this particular word or has learned this particular idea or concept and is repeating it, and they give a negative message to the child. And remember, children are very, very sensitive, as we all are, even as adults. And the child is going to pick up in your voice tone and facial expression and body language if you're angry or upset, or if you're telling them that they're doing something wrong, and that's going to cause them to hold back. And that's the opposite of what you want. So you don't want to say, where did you learn that? You want to say, oh, where did you learn that, honey?
Right.
Yeah.
Right. And then, when children bring a question to us, realistically, they don't need that much of information. I mean, we as adults know what involves in sex and sexuality. Children don't. So we need to pay attention to their question and precisely respond to that question, nothing more, nothing less. For example, an elementary child comes to you and will say, Mom, why do I have a vagina? And then, why do you call my private vagina? And then my brother has a penis, right? Why am I so different from him? Right? So the best course of action is, well, I'm glad that you know that you have a vagina and your brother has a penis, right? How did you learn about that? And tell me how you feel about that. And celebrate the child asking that question, having that awareness.
Right.
And then you can describe about little bit of about anatomy, that how a female body is different from a male body, and stay with that. Children would take that and they will walk away and they will go do other things, right? They're not going to force for more information, because they don't have more information. They don't have more, way of processing, because this is so new. So any information we give to them, they will take it and they will go and they will stay with that information that we give them. But if we don't do that, they're going to call their friends, right? They're going to go search online. They're going to go to sources we don't want them to go to. Now, when a child learns that she has a vagina and the brother has a penis, yes, they're going to take that information to their friends. They're going to say, guess what I learned today, right? So, and then that's a good, healthy action. We don't want to stop that either, because when she or he shares that information with a friend of same age, right? The other friend, if she has some more information that is age appropriate, they can combine those two together, and then they will come back to parents again.
Right. And so what we're talking about with sexuality especially, but really in all areas of informing our children, is to not try to give them too much information.
No. Yeah.
And the other thing,
because they can't process it.
Well, they don't know what to do with it. Yeah. It's just words. But the other thing, and that's the most important thing, of course, is to create a safe environment.
Right.
so that the child feels like any question that they're asking you is welcomed,
Right.
so that they feel safe to ask. Because as soon as they pick up your own negative reaction, which just might be your own nervousness, your own discomfort, the fact that you don't know exactly what the right answer is, it's better for you to say that, and you can say, well, thank you for bringing that question. It's something I need to think about, and I will get back to you as soon as I figure out how best to explain it to you, rather than give them a negative reaction as though they're bad for asking.
Right. And then, when we give any information about, sex and sexuality, bodily changes, usually kids at this age, they are more curious about their bodily changes because they see that, they feel that, right? And that's unfamiliar to them. So their question is more about the anatomy change versus the actual feeling and emotion of sexuality, right? So when we give an answer to one of their questions and we can say, do you think you want more information about that? Or are you happy with my answer? And then you can ask them, clarify. So now that you got the answer to your question, what do you think you're going to do with that?
Right.
So that way the child starts to think, okay, well, how am I going to share this information? What am I going to do with this information? And sometimes you hear, actually many times you hear that the child, they say, I don't know. Right?
Right.
So that means that they got some information, not they need time to process that. So we can open the door, leave the door open. Well, if you want to talk more about this, I'm here for you, honey.
Right. So yeah, and of course, everybody develops their secondary sex characteristics at different ages. So when my daughter was 9, she walked into my room without a shirt, and she said, "Dad, my nipples hurt." And I said, "Okay, well, let me take a look." And I looked, and I go, "They look okay to me." I said, that women start to develop larger breasts, and maybe this is your breast beginning to develop. And she said, "Oh," and that was it.
Yeah, that was it. Like I said, you just answered their question, and they will just take it and they will walk away, And then, so for example, a child may come to and say, okay, well, what is sex? I'm hearing people talk about sex, right? So simply put, sex is a relationship. It's a loving relationship between two people, right? And involved with that is kissing and touching and hugging bodies. Did I answer your question?
Right, exactly. You can always ask, did I answer your question? And if the child says yes, then great. And if the child says yes, but, and they have another question, then you just answer that question.
Right. Or we can start with one other form of question. Well, honey, what do you know about sex yourself? What have you heard about it so far? Would you please share that with me so then I know how much you know so I can help you with that and answer you more.
Exactly.
Right, because sometimes children do have already some initial information.
And sometimes it's misinformation.
It's misinformation, and they hear that from friends. They hear that from the news. They hear that on the, see that on the internet. They have all these blogs. They have all this social media, which is unbelievable. And each one of them, and who knows who's on the social media? They're not always children of the same age. They are all some people that they take opportunity to kind of take advantage of children's innocence, right?
Yeah.
So they are there and they provide information that they are not age appropriate and they are confusing.
Yeah.
Right.
I saw a movie a few weeks ago, and it was about kids, and it was a bunch of 11-year-old boys. And they were teasing this girl who was about 12 or 13, and they took her purse and they wouldn't give it back to her, and they ran away with the purse. And then they started going through the purse, and one of them pulls out a tampon, and he looks at it and he goes, "What is this?" And they're all like looking with it. I don't know what is this? And one of the boys goes, "This is a tampon." And they go, "What is that?" And he goes, "Well, it's something that girls put up their butts so they don't get pregnant."
Right.
Yeah.
Put up in their butt.
In their butt.
Right.
So they don't get pregnant.
So they don't get pregnant.
Yeah,
right.
yeah.
Yeah, and I'm not surprised. I'm surprised to say this, that even we see that in adults.
Mm-hmm. Oh yeah.
Adults even have so much misconceptions about how to use, contraceptive devices, or how to follow up with that, what are STIs, sexual transmitted infections, what are sexual transmitted diseases, right?
Mm-hmm.
And then we see that, we hear that. I mean, when clients talk to me, I see that they really can benefit from more education and more knowledge.
Yeah.
And the key to a healthy, happy, solid, joyful sexual life is to have more information. The more information we have about ourselves, about our identity, about our value system, about what sex is all about, the nature of it, how it happens, what does it include, and all of that, we're going to have a more joyful and healthier sex life.
More accurate information.
More accurate information. Yeah. Thank you for saying that.
Yeah, well, I mean, there's plenty of information, and if you look up something online, you can be reading, from today till next year, and still not get your question answered, or really know what they're talking about.
Exactly. Right. And then, one of the questions that comes up about this age group is, parents, they call, or they bring in their questions, and they are very frightened. My child is masturbating, and when they say that, I see the sense of overwhelming, emotions that they are, there. And then, first of all, some of them, they believe that maybe they have done something wrong, that the child at this age has, is starting masturbating, right? Or how do I stop it? How do I make sure nobody knows about this? And what if their father finds out? What if my wife finds out that, that our child is masturbating? And they are so, in a stage of panic that how am I going to stop that? Well, the reality is, when you see that in your children, first of all, know that this is normal. Why is this normal? Because that's the age that children become aware of their bodily sensations. They look at their bodily changes. Girls, boys, they look at themselves in the mirror naked. Girls are seeing that their breasts are getting bigger. They see that their body, from being so flat, suddenly it has a little bit of a curve to it, right? So they search themselves, they look up to themselves, and then they look at themselves in the mirror, they go back and forth, and they want to understand that. And with that looking, with that searching, with that curiosity, they also realize that there are some different level of emotions attached to that. Right. And then they touch their body because they want to identify with it. What's going on, right, with my genital all of a sudden? And that's when they experience the sensation. That's when they notice the sensation. And of course, sex being one of our biggest drive next to survival, right? So what do? That curiosity takes them to their sensuality, and they experience it.
Yes.
Right?
Yes.
And once they experience the first level of sexual sensation, it's very much powerful. Right?
Yes.
It's powerful,
yes.
And then they become confused, they become scared, they become happy. They want to know more about it. And the first person who's there and they feel safe with that person, meaning mom, hopefully, they come and they say it, right? Or mom noticed that, right? So when that happens, the children need support. They don't need punishment. They don't need to be shamed. They don't need to be frightened. They don't need to be embarrassed. They don't need to be told they are wrong about their feelings.
And so what would you say then to parents who do struggle with that? Who struggle with their own fears, their own shame, their own embarrassment, and their own lack of ability to communicate, what the child needs at that particular time in their life?
So that's a good question. What happens here, that we see that these parents are actually imposing their value system about sex and sexuality on their children, right? However they grow up and they felt about their sexuality initially and thereafter, right? Whether they feel shame about it, guilt, embarrassment, sinfulness, social taboos and all of that. That's the time that they kind of hand that value system to their children.
Right, it gets transferred down.
Right.
So maybe, after our next break, we can talk a little bit about what parents can do to educate themselves so they're not transmitting their own fearful and negative beliefs about what sex is.
Exactly.
Yeah.
So more of this after our commercial break. Again, don't forget to call us 951-922-3532. Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart-to-Heart program at KMET 1490 AM, ABC News Radio, with our topic today, talking about sexual health care with our elementary and preteen children. The subject that we, as parents, we pretty much relied on the school to handle that for us. But we see that with the school being closed for the most part and children learning their education online, health classes may not happen at the level that they did or may not happen at all. So based on the questions that we are getting from parents, we are offering you this program, and we are talking about how to talk to your elementary child or preteen child about sex and sexuality. And we talked about how we parent, we can actually, transfer our own value systems to our children the minute they come to us with a sexual question.
Right.
Right.
And we want to invite you right now, we still have some time in the program, to call us. Our first caller will receive a 15-minute free consultation with either Dr. Rashidian or myself. We will take your information offline and set that time up with you. Our number is 951-922-3532. And where we left off was, what do we do, what can parents do if they don't feel comfortable discussing their sexuality with the children, and when the children are of the age that they need the first discussion, because there should be a number of discussions based on the child's age and maturity level.
Right.
And if the parent doesn't feel comfortable, and if the parent feels embarrassed, and if the parent has some shame attached to it, coming from their own sexual upbringing and schooling, what can they do differently so that they're not going to be transferring those negative feelings to their sons and daughters?
Exactly. So that's why we're here, right? We're here to answer your questions. If you don't know what to say, it's okay to tell to your child, honey, that's a very good question you're asking. Can you hold on to that question, let's say, until 2 days, and then I will come back to you and give you the answer, right?
Right.
And meanwhile, consult with somebody who knows. And, we received a question from a friend that he asked, what about peer pressure? What about when children actually listen to parents, but there is so much pressure out there that children think that they may actually, respond to those pressures?
Yes,
right?
yes.
So one key point in particular that happens during middle school time, right? Is to be sure that your child is not a friend with somebody who's older than they are, right? Because once children are even, a year older than your child, right, they have more information about sexuality. They probably already have had some experience of some kind about sexuality, right? And then they're passing on that information to younger children or same age children because, it gives them a good feeling, kind of a superiority feeling, kind of a, I'm a powerful person and things like that. So making sure that your child is associating, is friends with age range, right?
Same age range.
Same age range, thank you. That's one of the key factors, right?
Well, yeah. And then when you say make sure, I don't know that parents actually have that control over the child to make sure. But I think the one thing that you can say is it's up to you as the parent to create a safe environment for your child to share with you exactly what's on their mind. That's something you can make sure of, because you can make it safe for your child to confide in you.
Right.
And that has to do with how you receive them in their not only in their questions, but also how you deal with their behavior. We have come from a civilization which has focused so much on behavior and ignored the reasons why the behavior happens and the thinking behind the behavior, that we've learned to just either reward good behavior or punish bad behavior, which we now know is not the healthiest way to raise a child.
Exactly.
Right?
Right.
So what you want to do is, if the child is having a behavior that you don't like, you need to talk to them about why you don't like it, and ask them what their thoughts are about their behaviors, and have them begin to think about it so that they can begin to monitor themselves, rather than relying on somebody outside of them to tell them what's right or wrong.
Exactly. So that means that don't allow your child to spend lots of free time with other kids, even same age group, without adult supervision.
Mm-hmm.
Right?
Mm-hmm.
Because that's when things can go wrong.
Mm-hmm.
Right? So that's another factor. And then, definitely, discourage them from having friends that they are older than they are. And as a parent, feel responsible to get to know the friends and also their parents and have a relationship with them.
That's a great idea.
Right.
Yeah, that's a great idea.
The more we know who the parents are, the more we're going to get to know the kids. And then the more the kids are going to feel responsible about what they're going to be doing. Because then anywhere that they go, there is a parent who's watching over them.
Mm-hmm.
Mm-hmm. And that's such a nice feeling to know that, your child is there. If they're going to a neighbor's house, or if they're going to a friend's house from a school, you know who they are, even what they're having for dinner, what they do during their free time. So then this is how you can feel safe.
Right.
Or safer at least. Right.
And it's of course it's much easier to do with younger children.
Right.
So as your children become getting into their adolescence, mm-hmm. They're going to have more freedom. They're going to require more freedom, and it's important that you give them more freedom. But if you've set it up in your relationship with your children, that your children feel safe to confide in you, then they will when the need arises.
Right.
And that's what we're trying to create.
Right. So sometimes, these preteens, they come forward and they ask very explicit sexual questions, mm-hmm. right? What does it mean to kiss the way two people kiss on the mouth? What is French kiss? What does it mean when penis gets into the vagina, mm-hmm. And, an elementary child would say, what do you mean by period? What do you mean by, I'm going to have to bleed once a month? And so their questions, when you look at them, they're so innocent, mm-hmm. right? Mm-hmm. They can make sense out of it. These are the questions that they hear from everywhere.
Right.
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 So the worst thing that we can do is for us to tell them, hush, you don't need to know that yet. Mm-hmm. Right.
Right. Right.
So the more accurate and the more simple and the more right to the point according to the question we respond to them, the safer, the more powerful, and the best answer those are going to be.
Right.
And anywhere you get stuck, just go and educate yourself.
Yeah. And often kids will use slang terms.
Right.
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 They're usually not going to use correct anatomical terms.
Right.
So they will use slang terms that they've picked up and they've heard. And it's important as a concerned parent not to shame the kids for the slang, right. But to simply say, well, that's a slang term. That's not the exact term, but here's what it means, and here's the function of it, and this is the way that I think about it, and you're free to think about it in your own way. But you share with your child, how you feel about that particular slang term or about that particular sex act based on your child's appropriate age.
Exactly.
Mm-hmm.
I mean, some parents, they say that their children, they have noticed that their children are watching porn,
Mm-hmm.
right?
Right.
And they share about how the child is reacting when they see porn.
Mm-hmm.
They say, oh my God, what is that? Holy, we see that, and so, and that's a normal reaction because they don't know what they're seeing.
Mm-hmm.
But they see something totally unusual in their mind,
Right.
Because they haven't seen it before.
Right. Mm-hmm.
So when you see a child during that kind of an action or responses,
mm-hmm.
right? Don't frighten them. Don't shame them. Again, right?
Yeah.
It's all about how you welcome their reaction.
Right.
And then ask them questions, simple question like, what did you see and how do you feel about it? What's the meaning that you give to what you saw?
Right. Yeah. So that means that responsibility is what I think of as two words. I think response/ability, or the ability to respond to something rather than react.
Right.
Is really what you want to cultivate within yourself.
Exactly.
So that you can model that for your child, and then you can be able to respond appropriately without putting any negative judgment on your child's questions or belief system. You simply say, well, that's an interesting thought, or that's an interesting belief. What makes you think that?
Right.
What makes you feel that? And you try to draw the child out. And then as you do that, you say, well, that's interesting, and this is something that I think about it. And then you can share what you think. And then if what you think makes more sense to the child, they will let go of what they have thought, and they will adopt what you think.
Right. And then the other point, about sex and sexuality, whether that's elementary age or whether that's a middle school age, is important for parents to kindly and gently and firmly actually, let their child know about the harm of sexual relationship,
mm-hmm.
right? So that's a good time during elementary and middle school to teach the children that if they are not careful about their body, if they're not careful about who to ask their questions, there could be consequences.
Absolutely.
Right?
Absolutely.
And then explain some of those consequences, forced bodily injury, child abuse, getting sick, so that we can actually explain a little bit about what is sexual transmitted infection.
Depending upon the child's age.
The child age.
Now, we've got about 5 minutes, and I want to, again, remind our listeners that we're still giving away a free 15-minute consultation about any subject of your choice. You can call us 951-922-3532. And if we don't hear from you today, we will repeat it tomorrow when we have our show on addiction and codependency.
Exactly.
Mm-hmm.
Right. So that's our program for tomorrow morning at 9:00. And what else do we want to say, Dr. Jaffe, about preteen sex education? It's important for children to know about their bodily function. It's important for them to know that sex and sexuality and the associated feelings with that are pretty much normal.
And also, I think, as early as the child is able to understand, it's important to let the child know not just that sexual feelings are normal, but that sexual feelings feel great.
Right.
Because people often don't talk about that. They don't talk about how powerful and how wonderful it feels to have sexual feelings.
Right.
And so children are often surprised when they start to feel their sexual feelings and how powerful they are, and nobody has told them to expect anything like this. And so the older the child, the more you can actually say, this is the most powerful feeling that a man or a woman can have in their body, and that because it's so powerful, you need to understand as much as you can about it, so that you're free to make intelligent decisions in terms of your sexuality.
Exactly. So as we see, you're that teacher, you're that health class teacher right now as a parent,
Mm-hmm.
right? And you're the one that need to actually educate yourself about sex and sexuality, about elementary child or a preteen child. And then in the future, we're going to talk about older children. But for now, you're it, and it's lots of pressure. So please call us if you have any questions. That's why we're here. We're here to answer your concerns, and we are here with you during this pandemic area. And don't forget tomorrow morning to please join us for another episode of Dr. Jaffe's program about codependency, trauma, addictions, and impact of all of that on our relationship, which we can never get enough of that, as we know it's a very vast area. And we'd like to invite you, and don't forget to call us for your free consultation, 951-922-3532. And until tomorrow morning at 9 o'clock, don't forget, all you need is love.
Love, love, love.
Have a wonderful afternoon.
Bye-bye.
This is 1490 AM KMET Banning.